project on stillbirths in sub-Sahara Africa. A failed pregnancy is considered a stillbirth when the infant dies in its mother's womb after a period of at least 20 weeks. Although a pregnancy is considered a stillbirth when the infant dies inside the mother's womb, some infants' deaths are being misclassified as stillbirth. Strictly speaking, stillbirths are fetal deaths. Nevertheless, live-born infants who are inadequately resuscitated and die may be misclassified as stillbirths. Stillbirths are very prevalent in sub-Sahara Africa, as it is in any other underdeveloped regions of the world. According to the World Health Organization, the rate of stillbirths there is approximately 10 times that of developed countries, which is a staggering difference. The high rates of stillbirth result from poor maternal health and inadequate antenatal and postpartum care. We believe that with proper intervention, these numbers could be reduced. The major cause of stillbirths in sub-Saharan Africa are poor antenatal and interpartum care of the mother.
This is me, sorry. In order to prevent stillbirths in sub-Saharan Africa, we plan to initiate a program that will provide education for the mothers and community healthcare workers. We want to teach them how to prevent issues that are associated with stillbirths. The education we will be teaching will be focused on prevention and management of maternal infections such as malaria and syphilis, management of maternal hypertension and diabetes, protection and management of fetal growth restriction, better health care during delivery, and respectful care for those who have gone through the stillbirth experience.
Because of you, afraid the master is not witness. You knew I was a warrior. Always knew. What?
I'm so sorry, guys.
What did you do?
Stillbirths in low-income countries leave the mother with many challenges, such as ill health, grief, sadness, and coping with community perceptions. The father is also affected by these difficulties and can take a long time to recover from a stillbirth. In some instances, only when another baby is born and survives, or in some other cases, never. Parents can find it difficult to express how they feel after a stillbirth, especially when cultural beliefs mean that stillborn babies are considered strangers to the community, and as such, their deaths are not deemed to be a human death. The stillbirths that are occurring at such a frequent rate in sub-Saharan Africa are detrimental to families. Not only do the stillbirths result in increased health risks to the mother, but it also has an effect on her mental health and overall well-being, and the well-being of her husband and other family members. The tragedy of this loss of life could be prevented in many of these cases. With education of pre- and postnatal care and help of the mother and child, there could be increased numbers of healthy births, thereby lessening the burden on some families by saving the lives of their children.
We plan to form a program that would ensure distribution of insecticide-treated nets. This seems to be a need according to this article. Over the past decade, significant gains have been made in the implementation of malaria prevention measures in pregnancy in sub-Saharan Africa, including the distribution of insecticide-treated nets. These have been shown to cause a reduction in the incidence of malaria and its consequences, such as maternal anemia, stillbirths, and intrauterine growth restriction. Currently, most nations in Africa have policies for distributing the ITNs to pregnant women through various mechanisms. However, coverage remains well below the targets. Another infection that can lead to stillbirths is syphilis. All expecting mothers should be tested during their first trimesters, preferably before 16 weeks. If they test negative, they should become aware of how it can be prevented. If they test positive, it is also a good idea to get screened for HIV. They should talk with their care provider about a treatment plan for their baby once it is delivered. Both hypertension and diabetes can be managed during pregnancy. The Mayo Clinic recommends talking to a care provider about safe medications that can be prescribed during pregnancy, if needed. A low-sodium diet and exercise can also be beneficial when managing high blood pressure. According to the March of Dimes, diabetes can be controlled and treated during pregnancy, but if not treated, it can cause problems during pregnancy. Among these problems are stillbirths. The American Pregnancy Association states that the importance of monitoring blood glucose levels and eating a balanced diet throughout pregnancy. This includes protein, which can be consumed in the form of lean meat, legumes, and nuts, calcium, such as dairy, eggs, almonds, and cabbage, iron, including dark leafy greens, as well as folic acid, whole grains, such as oats, breads, and cereal, vitamin C, fruits, especially citrus. As with any pregnancy, moderate physical activities such as walking and swimming are great for both mom and baby.
Bailey.
There a cause is a fetal an article on MD. Many causes. A common cause is a problem with the placenta. The placenta is the tissue that joins the mother and fetus. It carries oxygen and nutrients to the baby and permits the release of waste products from the baby. Condition can also occur as the result of certain health problems in the mother, such as advanced diabetes, high blood pressure, or heart disease, infections such as rubella, cytomegalovirus, toxoplasmosis, and syphilis, kidney disease or lung disease, malnutrition or anemia, sickle cell anemia, smoking, drinking alcohol, or using drugs. The best preventative care is to take the necessary precautions. Be aware of your body and notice any changes or symptoms that may occur. You are your best doctor. If you don't feel well, you are the first one to know. Be aware of your symptoms and check with your local doctor and get tested. It's best to treat the symptoms at an early stage, then wait when the symptoms get worse.
So, first aid education. We intend to teach first aid skills to families in hopes of enabling them to resuscitate infants after birth. Many infants die because they are not breathing when they are born. Basic first aid knowledge can save the lives of many of these children. BYU's capstone program came up with a program where they could create a ventilator. That's about $500 to purchase. Normally they are about $40,000, but this could enable, if this program, we could utilize this program to help people in sub-Saharan Africa to possibly have access to another way to save their children after birth rather than performing CPR. So with the combination of that and the education, hopefully more infants' lives could be saved. According to the World Health Organization, almost half of stillbirths occur during labor. Although there is only a small risk of stillbirths in post-term pregnancy, it is still a notable one. Healthcare providers should closely monitor the baby and possibly perform a non-stress test. If needed, the healthcare provider may choose to induce labor to prevent complications. Here are our references. Thank you for watching our presentation.